Hello everyone. We will continue the strengthening techniques with shoulder internal rotators. What are the shoulder internal rotators? They are subscapularis, teres major, latissimus dorsi, pectoralis major, etc. If the grade of internal rotator muscle is grade 2 on MMT finding, that is, if the strength of the muscle is grade 2, what will be the technique to strengthen grade 2 muscle? We will be strengthening grade 2 internal rotators using suspension therapy. You can view the demonstration here for how to strengthen internal rotators. First of all, the position of the patient should be in sitting so that the internal rotation movement can occur in horizontal plane. As the grade 2 strength muscle cannot perform against the gravity, therefore it should be moving in horizontal plane. The patient should be in sitting position and the forearm should be suspended on the sling. The arm should be by the side of the body and elbow should be flexed so that forearm will be suspended. Then we will ask the patient to perform internal rotation. We can ask the patient to perform internal rotation for 10 repetitions and ask the patient to repeat it for 3 sets. If the strength of the muscle, that is internal rotators, improves from grade 2 to grade 2 plus or 3 minus, then we can use the technique that is active assisted range of motion exercises. Here, some amount of movement can be created by internal rotators but cannot complete the range of motion against the gravity. Therefore, therapist will be assisting the range of motion of the patient for internal rotation. Here is the video demonstration where patient initially tries to fulfill the range of motion. If patient fails to fulfill the range of motion, therapist will be assisting the movement. For this particular exercise, patient should be in side-lying position with arm by the side of the body and elbow flexed to 90 degree so that patient can perform internal rotation against the gravity. As we know, grade 2 plus and 3 minus means patient cannot fulfill the range of motion against the gravity. Therefore, therapist will be applying the assistance. Once the muscle strength of the internal rotators reaches grade 3, or if the strength of the internal rotator muscle is grade 3, then we can apply the technique of strengthening which is called as active range of motion exercises, where patient will be performing full range of motion against gravity. That is, patient can perform internal rotation of the shoulder against gravity to full range of motion. Here is the video demonstration where patient performs full range of motion against the gravity and patient doesn't require any assistance from the therapist. We can ask the patient to perform 10 repetitions of shoulder internal rotation for 3 sets. Patient's position should be in side lying, the arms should be by the side and elbows should be flexed to 90 degree. From grade 3, if the strength improves to grade 3 plus, then we can apply resistance. Resistance can be applied in the form of TheraBand, dumbbells or weight cuffs. Here are the video demonstrations where TheraBand is used for strengthening the internal rotators. So TheraBand should be aligned in such a manner that it provides resistance against internal rotation of the shoulder. So patient is in sitting position, arms by the side adducted and elbow flexed to 90 degree. And patient is instructed to perform internal rotation against the resistance of the TheraBand. Second video demonstrates how dumbbells can be used for strengthening the internal rotators, which is 3 plus. So as you can see, patient is in side lying position and arm is adducted, elbow flexed to 90 degree where patient is instructed to perform internal rotation against the resistance. We can instruct the patient to perform 10 repetitions into 3 sets. We can use any of the regime, which is Delorme regime, Oxford regime, or McQueen regime. Let's move on to next slide, where we can learn how to strengthen shoulder external rotators. Main shoulder external rotators are infraspinatus and teres minor. If the grade of muscle is 2, that is, if the strength of the muscle is grade 2, we will be using suspension therapy, where the forearm is supported on the sling, arm of the shoulder of the patient is adducted, and elbow flexed. Once the strength of the external rotator attains 2 plus or 3 minus, then we can apply active assisted range of motion exercises for strengthening external rotators. In grade 2 plus and 3 minus, patient cannot fulfill the range of motion. Therefore, assistance from the therapist is required. So patient is in prone lying position, shoulder abducted to 90 degree and elbow flexed to 90 degree. Patient is instructed to perform external rotation of the glenohumeral joint, where the therapist will be assisting the movement if the patient is not able to fulfill the range. If the external rotator grade is grade 3, then we will be applying the strengthening technique, which is active range of motion exercises. Patient can perform actively full range of motion for external rotation. The position of the patient should be prone lying, arm abducted to 90 degree and elbow flexed to 90 degree, and the patient will be instructed to perform external rotation to full range against the gravity. Patient can repeat this movement 10 repetitions for 3 sets. Strengthening of shoulder external rotators. The heading here, it is written internal rotators. It is strengthening of shoulder external rotators. So if the muscle grade improves from grade 3 to grade 3 plus, or if the strength of the external rotators is 3 plus, that means patient can take some amount of external resistance against the movement. Here we can apply external resistance. We'll start with minimal external resistance and gradually progress to maximal external resistance. So initially we can use minimal resistance like TheraBand or lightweight dumbbells. So first video demonstrates how to use TheraBand for improving strength of the external rotators beyond grade 3 plus. Patient's position should be in sitting. The TheraBand should be fixed on the distal part of the bilateral upper limb. Patient is instructed to keep the shoulder joint in adducted position with elbow flexed to 90 degree, and patient is instructed to perform external rotation of the shoulder bilaterally. Coming to strengthening shoulder retractors. What are the shoulder retractors? Rhomboids and middle trapezius. If the rhomboids and middle trapezius strength is grade 2, we will be using suspension therapy. Here you can see the demonstration video where the position of the patient is in sitting position, so that the retraction of the scapula along with shoulder horizontal abduction can occur in horizontal plane. Patient's shoulder is abducted to 90 degree and elbow flexed, and the arm and forearm is supported on the sling. Then patient is instructed to perform shoulder retraction with shoulder horizontal abduction. Next, when the strength of the muscle improves from grade 2 to grade 2 plus or 3 minus, we will be using active assisted range of motion exercises to improve the strength of the shoulder retractors. For this, patient should be in prone lying position, arms should be hanging out of the couch, and then we'll instruct the patient to perform shoulder retractors. For grade 2 plus and 3 minus strength, patient can perform against the gravity but cannot fulfill the range. Therefore, there should be assistance applied by the therapist. Here you can see the muscle is weak, therefore patient is not able to fulfill the range. So physiotherapist will be applying the assistance. If the shoulder retractors muscle is grade 3, we will be using active range of motion exercises to improve the strength. For improving strength of medial trapezius, we will ask the patient to lie prone and shoulder externally rotated, which will be indicated by thumbs pointing upward. Then we'll ask the patient to perform shoulder retraction along with shoulder horizontal abduction. For improving the strength of rhomboids, we will ask the patient to lie prone and internally rotate the shoulder, which will be indicated by thumbs pointing downward. If the strength of shoulder retractors is grade 3 plus or it improves from grade 3 to grade 3 plus, then we can apply some resistance. In first video, it demonstrates how to apply TheraBand for shoulder retractors. Patient should be in sitting position, shoulders abducted to 90° and elbow flexed, and the TheraBand should be aligned in such a manner that patient can perform retraction against the TheraBand resistance. In second video, we can see the dumbbells is used as a resistance against retraction of the shoulder. Here, patient should be in prone lying position and the patient will be instructed to perform retraction against the weight.